Deliver the impact of problem-based learning to the learners of tomorrow. Problem-based learning is great for the virtual environment. It's highly engaging and facilitates communication amongst the group participants. Now Dr. Buckstein will talk to us about what's entailed in problem-based learning online.
Entails doing a case and then discussing some of the aspects of that case in a more didactic fashion after we've fully dissected the diagnosis and the treatment of difficult to control allergic rhinitis. So without further ado, let's get started.
Establishing comfort, even online, is very important to facilitating online group communication, which is why at the beginning of every problem-based learning session, all the group attendees introduce themselves.
Hi, I am Shannon. Shannon Carver. I am in New York City, the Bronx to be exact. I am a nurse. I am also a certified asthma educator, and I am starting an asthma program in the city of Mount Vernon.
Thank you. Marcel.
Vishal Patel, adult pulmonary critical care physician from Michigan.
And Mary Beth.
Hi, I'm a nurse in private practice. I'm an RN and an asthma educator also. And I'm from Buffalo, New York, unless I said that already.
Okay, that's okay. We're reintroducing and Kathleen.
My name is Kathleen Ellis, and I am a nurse practitioner and also an asthma educator certified, and amongst other things. And I have worked with patients with asthma and rhinitis for my entire career. So, and I'm very, very interested in shared decision making and have used that throughout my career also. So I think
So today, what we're going to do is you see in front of you a case. And I need a volunteer to read the case for me, the first part of the case, and we'll go one step at a time. So if I can have somebody read the first part of the patient's history. Anybody?
Okay.
Okay, you want me to go?
Shannon, go ahead.
Randy S. is a 30-year-old construction worker who presents to your office as a new patient with the chief complaint that my allergies are really bothering me this season. He narrates that the last few years I have been noticing frequent runny and itchy nose and eyes in the early summer for almost a full month, usually just taking one of those OTC antihistamines.
History here.
Family history. His mother has a long history of hay fever each spring and fall, and his father has asthma. Social history. His real passion is coaching his son's little league baseball teams, but notices his allergies are most intense during their season.
Okay. So now you got any other historical facts any of you wish to ask? Okay, so what are your impressions, Mary Beth? Do you have any new impressions before we had allergic rhinitis, possibly asthma, allergic conjunctivitis? Any new impressions?
No, I just think his allergies have just gotten worse. He's hit his threshold, and everything now that he might have not had a problem with is now reacting with them.
Okay. Any new diagnoses?
Well, the chronic sinusitis now, his sinuses are being affected now.
So may have some sinusitis now. Okay.
Right. And the asthma, because the wheezing is being manifested now, the cough could be related to that or postnasal drip.
Would you want to classify his asthma, any of you? Give it a more of a descriptor?
Mild, intermittent. I mean, we don't really have a good history yet, though, of what his asthma symptoms are, because he's wheezing now, but we don't know what trouble he has had really yet. We need more history on that before you can really classify it.
But he says he wheezes on and off with activity, and lately he's been wheezing almost every day using
So
his
he's probably, well, he's not well controlled to begin with, so he's probably more moderate
I would say moderate to severe persistent. I agree.
Yeah. Yes.
Okay. So what are our recommendations? What do you guys want to do?
Well, again, to do the breathing test and give him the inhale and nasal corticosteroids again. Give him the inhaled corticosteroids now, of course, after the breathing test to control his wheezing and cut down the inflammation. If he's feeling bad, I would give him the steroids right now, the oral steroids, systemic steroids right now to help him feel better over the next week or so. And that would be to start out with, along with some antihistamines.
What do the rest of you think? Any other ideas of recommendations? Or other lab, or we want to get pulmonary functions, want to do skin testing, anything else? Well, Randy returns for a follow-up visit after the weather has turned cooler. He notes he got much better recently, just having some daily year-round congestion he just deals with. His wife told him to quit snoring so loudly after the weather told him that he quit snoring loudly after the weather turned cooler. He still feels fatigued, even though he is not on any oral antihistamines. He stopped all his medications 2 weeks ago and wants to discuss what his other options are and hopefully prevent such a frustrating symptoms next summer through fall when he really wants to do the Little League team. What do you discuss with him now, and what is his informed personal preference? You've referred him to the allergist, but he can't get in for a few weeks and doesn't especially want to pay another copay. And he's saying, can you do anything for me as a kind of a primary care physician? Any thoughts? But we have up here shared decision making. How would you guys define that in a patient like this who's not very adherent, still having problems? How do you define that?
I would say it's sitting down, the healthcare provider sitting down with the client and talking, saying there's several ways we can treat this and delineating those. What are the, pros and cons about each one? And then, asking the patient what does he think, he would like to do?
Excellent. What do the rest of you think? Any other thoughts?
Yeah, I agree. Well, I guess that to find out the factors which are preventing him from using this with compliance would be important, whether it's a lack of education, whether it's not being effective, whether he thinks that they are not needed, or whether he thinks that they should be just use PRN on as needed basis. And that will be important to find out in process of the shared decision.
Okay. Any other thoughts about what shared decision making is?
To see what his goals are and what his perceived outcome would be or should be.
Okay.
Yeah.
Excellent.
Like, that's what I was going to say. What was important to him, and really impressing upon him, like his goal is to be able to coach the Little League, and then providing him the evidence, and then that third piece, taking like what's preventing him, what factors are there, and then kind of, educating based on that, building off of that.
That's true. And really, in our patients, one of the things we don't kind of establish at the beginning enough, I think, is their personal perception of their disease, the PPI, their perception of their disease and their goals of therapy.
I want to thank you for this. This is absolutely great. It's very interactive, which I like. I love having everybody on the panel. We all have like a little bit different backgrounds. So I've been able to learn a lot from not only you, but all the other panelists. So I I think this is really good, and I absolutely love doing a case study. So
Yeah, I think this is great. This was amazing, and I'm gonna try this with my fellows so that when I'm giving a talk, get the cell phone. Well, this will be very difficult to set up the system, but this will be good to try it on them so that they are paying attention. They are all there. I can ask them for their input, questions. It's great for the attention span. This is wonderful.
Great. Thank you, guys. And Kathleen.
I think that problem-based learning, the Socratic method, really works well, and it brings out the best in education. I think that the people that we're going to be using this with will really rack their brains, and really use everything that they have to think of things to do for Randy. And, it's painless. You really get involved in it. It's not like sitting listening to a lecture or a PowerPoint or some crazy thing where you might want to doze off or something at this hour of the night. So I just thought it was fabulous. And thanks again for inviting me.
Well, we want to thank